question. Member from Newmarket, Aurora.
Thank you, Speaker. To the Premier. Speaker, the Minister of Health continues to defend her ministry's failure to oversee the province's emergency services and their mismanagement. And it continues. Last week, there was no air ambulance available to respond to a serious collision in the GTA because Ornge was incapable of managing its shift change. The patient died. The Minister's response, we'll look into it. Today, we learned that a man in his 30s died yesterday here in Toronto, waiting for a land ambulance that never showed up. The highest priority level emergency call, and there was no ambulance. I ask the Premier this: how many more deaths will it take before he acknowledges that his Minister of Health and his Emergency Health Services branch are incompetent and cannot manage this file? And when will he put someone in charge who knows what they're doing?
Be seated, please. Be seated, please. Premier.
Speaker, I do not share my honourable colleague's perspective on this. I will say that whenever there is a tragedy that unfolds, we are obviously extending our sympathies to the family and friends of those affected. But I must say, Speaker, on behalf of I think there are some 7,000 paramedics employed in the province of Ontario, and I believe there are some 1.4 million calls on an annual basis to which they respond, that overwhelmingly, in the great majority of cases, they do the very best that they can, and they provide extraordinary quality care to Ontarians who find themselves in emergency need. Speaker, we will look into each and every one of these cases where there appears to have been something amiss, but Ontarians can and should continue to have confidence in their ambulance system.
Thank you. Supplementary.
Speaker, air ambulances can't respond because shift changes can't be managed competently. Land ambulances can't respond to the highest priority emergency call because scheduling can't be managed. Frontline emergency workers, doctors and schedulers have been warning this government and this minister for years that there is a systemic problem. Speaker, the real emergency is in the minister's office and at the Health Services branch. It is apparent that the vital signs are absent there. I'm going to ask the minister one more time. If in 2 weeks there were doctors not available in emergency wards to look after patients who arrived there, the minister would immediately step in. Why is it that she allows the emergency services branch of this province to continue to demonstrate this kind of incompetency? Why can't Ontarians count on their ambulances to be there?
Speaker, I'll remind again, once again, my honourable colleague, that paramedics are now responding to 1.4 million requests each year. There are some 7,000 of them working to the very best of their capacity, Speaker. I'll remind them as well that we've also invested, we will be investing this year $16 million to fund nurses to assist incoming patients at the hospitals. I'll remind him as well that most of our ambulance services are delivered by the municipalities, Speaker, and I'll remind him again that we have uploaded some of those costs. We're now sharing it on a 50-50 basis, something their party continues to oppose, Speaker. Again, we will continue to work in partnership with our frontline workers to ensure we're delivering the best possible care to Ontario families.